Hey guys, quick video on pronation and supination mechanics in 3 dimensions. So we're going to take a split stance and we're going to start with pronation, so front leg. What I want to happen is we're going to bend that front knee. Okay? Weight is over that front leg. The back leg is just kind of kickstanding you. Bent knee, your tibial tuberosity here is traveling forward and down. You should feel your foot expand. The arches of your foot are getting bigger. Your foot's actually getting longer. Your heels stand on the ground and your foot tripod is on the ground. Okay? So knee traveling forward. Your pelvis is also anterior tilted. So these bony parts of your pelvis, your ASIS, are also traveling forward and down, parallel lines with your knee, okay? But you're staying stacked, okay? So rib cage tilts upward, so the pelvis was anterior tilting, rib cage is posterior tilting, and you're gonna look forward as well. If you wanted to get the arms involved, you reach back behind you. That's in the sagittal plane, okay? To bias the frontal plane, same thing, okay? But if we have our hands on our pelvis, we're going to drop the back pelvis of the back leg. If you think of your pelvis as a teeter-totter, you have the heavier kid on this side, and this side is hiking up. You're feeling even more pressure on the inside of your foot. Okay, just keeping things stacked. And then the last range, the transverse plane, so you're going to rotate your pelvis this way. It helps to reach. The knee wants to go in, but keep the knee over in the foot corridor. Pronation. And just hold here. You can hold and breathe. Or you can go back and forth. Good, that was pronation mechanics. Supination mechanics is essentially the back leg. Okay, so back leg, 2 points of contact with your back forefoot. Your heel is off the ground a couple inches. So again, not a big step, just something like this. Okay, you're going to now posterior pelvic tilt. So tilt the pelvis backwards. Think of your pelvis as a bowl of cereal. You're pouring the cereal at the back end. Ribs stay down. Feel a good stretch on the hip flexors here. Straight knee. Don't allow the knee to bend with this. Straight knee. Stretch here. Ribs down. Looking forward. That's sagittal plane. If you want the arms involved, you do a little bit of protraction. Frontal plane, okay, same thing. Of sagittal plane, keep the pelvis back. But again, we're going to drop the pelvis. So this pelvis is higher than this pelvis. Keep the knee straight. Keep 2 points of contact with the back leg. Stay stacked, not doing any of this. Okay. Drop that pelvis. Whole pelvis goes that way. Frontal plane. Then last is the transverse plane. So again, you're going to rotate the pelvis to either 10 o'clock or 2 o'clock. You can reach. Don't let that back leg pivot. Keep it straight. Rotate. Feel the back leg kind of torque up. Your back foot's in a nice banana shape, a good supination. Okay, 2 points of contact. You could leave your pelvis behind. Bring your chest forward. Okay. Just breathe, hold. Good, and that's supination mechanics.